Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about peptic ulcer disease. We are going to see what is peptic ulcer disease is, what are the symptoms of it, and what are the causes, and what are the complications, what are the tests available for this condition, and what are the treatment options available, and how to prevent this condition. So let's get started. What is peptic ulcer disease? Peptic ulcers are open sores that develop on the inside lining of your stomach and the upper portion of your small intestine. Let us see the symptoms of this condition. They are nausea, vomiting, heartburn, intolerance to fatty foods, feeling of fullness, bloating and belching, weight loss, fainting, bloody or dark tarry stools, burning stomach pain. Now let us see the causes of this condition. The first cause is the H. pylori bacteria. The H. pylori bacteria stick to the layer of mucus in the digestive tract and cause inflammation, which can cause this protective lining to break down. This breakdown is a problem because your stomach contains strong acid intended to digest food. Without the mucous layer to protect it, the acid can eat into stomach tissue. Now the second cause is regular use of certain pain relievers. Taking aspirin as well as certain over-the-counter and prescription pain medications called NSAIDs can irritate or inflame the lining of your stomach and small intestine. These medications include ibuprofen, naproxen sodium, ketoprofen, and others. They do not include Tylenol. Third cause is the stress. Stress due to serious health problems, such as those requiring treatment in an ICU, is well described as a cause of peptic ulcers, which are also known as stress ulcers. Now let us discuss about the complications of this condition. If left untreated, peptic ulcer can result in number 1. Internal bleeding. Bleeding can occur as slow blood loss that leads to anemia, or as severe blood loss that may require hospitalization or a blood transfusion. Severe blood loss may cause black or bloody vomit or black or bloody stools. Now the second complication is a hole, also known as perforation, in your stomach wall. Peptic ulcers can eat a hole through perforate the wall of your stomach or small intestine, putting you at risk of serious infection of your abdominal cavity called peritonitis. Now the third complication is the gastric cancer. Gastric cancer. Studies have shown that people infected with H. pylori have an increased risk of gastric cancer. Let us discuss about what are the tests available to diagnose this condition. The first one is the blood test. Doctors may use blood tests to check for signs of H. pylori infection. For a blood test, a healthcare professional will take a blood sample from you and send the sample to a lab. Second test is the urea breath test. Doctors may use a urea breath test to check for H. pylori infection. For the test, you'll swallow a capsule, liquid, or a pudding that contains the urea, labeled with a specific carbon atom. If H. pylori is present, the bacteria will convert the urea into carbon dioxide. After a few minutes, you'll breathe into a container exhaling carbon dioxide. Third test is the stool test. Doctors may use stool test to check for H. pylori infection. Now the fourth test is upper GI endoscopy and biopsy. Doctors may order an upper GI endoscopy to confirm the diagnosis of a peptic ulcer and try to find its cause. For an upper GI endoscopy, a doctor uses an endoscope, a flexible tube with a camera, to see the lining of your upper GI tract, including your esophagus, stomach, and duodenum. During upper GI endoscopy, a doctor obtains biopsy by passing an instrument through the endoscope to take small pieces of your tissue from your stomach lining. A pathologist will examine the tissue under a microscope. Now the fifth test is the upper GI series. Doctors may order an upper GI series to help diagnose peptic ulcers or ulcer complications. Upper GI series uses X-rays and chalky liquid you swallow called barium to view your upper GI tract. Now let us discuss about the treatment options for peptic ulcer disease. The first one is the proton pump inhibitors. These drugs reduce acid, which allows the ulcer to heal. PPIs include Prilosec, Prevacid, Acifex, Protonix, and Nexium. Second treatment option is the histamine receptor blockers, also called as H2 blockers. These drugs also reduce acid production and include Tagamet, Pepcid, Zantac, and Axid. Third treatment option is the antibiotics. These medications kill bacteria. Doctors use them to treat H. pylori. Fourth treatment option is the protective medications. Like a liquid bandage, these medications cover the ulcer in a protective layer to prevent further damage from digestive acids and enzymes. Doctors commonly recommend Carafate or Pepto-Bismol. Now let us see how to prevent this condition. Prevention. Washing your hands frequently to avoid infection. Second, limiting your use of painkillers. Third, quit smoking and alcohol. Fourth, consume foods that have been cooked thoroughly. Fifth, managing your stress. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.